the key focus is around the case for sort of time-varying treatment pathway analyses and the case for treatment duration presentation within treatment pathways. And so what I picked was Crohn's disease and ulcerative colitis, although this would be broadly applicable to almost any of the immunology conditions where there's a large array of heterogeneous agents that are utilized, and those pathways have sort of been changing and evolving over time as guidelines have been changing and evolving over time. So I just picked Crohn's and ulcerative colitis and just highlighted a few. So you have a very nice eye, your indication of ulcerative colitis or Crohn's disease. We have phenotypes for those, and then very much characterizing the pharmacotherapy of these and seeing how they align to current guidelines. So I don't have specific outcomes. I think some of these outcomes are actually hard to measure, and some of these things are hard to get at within some of our data infrastructure with regards to understanding the full surgical history, the Crohn's disease activity scores, and some of the other key metrics that you would need out of the data. But I think our data is ripe for characterizing these pathways and assessing how people have adopted the guidelines or not adopted the guidelines over time. These are just where the quality of evidence is either a knowledge gap or very low for ulcerative colitis, but really you could be looking across the entire spectrum of the guideline and assessing adoption of those guidelines. Similarly, with Crohn's disease, again, focusing on the adult outpatient settings, there's another broad list of recommended and non-recommended and passively recommended lines of therapy that we could monitor how they have changed over time. But there's two real key components to advance the science here. One is a more robust time-varying treatment pathways type analysis, and second, really getting in at duration of time people spend in each of those donuts, if you will, from the donut, the rings that we've done for treatment pathways.